Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Despite having such a high vaccination rate, close to 80% right now, South Korea is still suffering through this fourth wave of COVID-19 and making matters worse, as we've been talking about, placing even greater strain on health services is the sharp rise in the number of seriously ill patients. On Wednesday, a record 460 people were recorded to be seriously ill with COVID-19 in South Korea.
And Korea is not the only country experiencing this, as many European and other highly vaccinated Asian countries are releasing data that shows the same is happening there as well. For more, we are joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Morning.
Now, we were told these vaccines would protect people from becoming seriously ill with COVID-19. So why are we seeing this sharp uptick in the number of critically ill, many of whom have had both shots?
It's really worrying, and it's not only being seen in Korea, as you mentioned, it's being seen in many other parts of the world now. I think third doses could make a massive difference. You mentioned in Korea there's a third dose program, but the numbers are still very low. The experience elsewhere is that once those numbers with a third dose can get up to a higher level, then this issue will be mitigated quite substantially. So I hope that the third dose program can be ramped up even faster, and maybe in the short term it will be necessary to tamp down transmission with some additional measures.
Now, people in South Korea and in other countries suffering from this trend right now are naturally very, very worried about the tremendous strain this is placing on what has already been an overburdened health system for a couple of years now. To give the people out there a clearer picture of just how draining it is, can you just explain the kind of level of medical care required to treat someone, just one individual who's gravely ill with COVID-19?
It's really tough. And as you mentioned in your coverage just now, the healthcare workers need a lot of protective equipment, and that takes a lot of time to put on and take off. So it's a lot of work for the healthcare workers to just manage one case in and out of the room with a lot of medical equipment that's needed. And the other really important thing to recognize is that these cases are not just in hospital for a few days. Severe cases, cases of severe COVID are typically in hospital for up to a month. And then what you find is that even if the numbers seem small, because the patients are staying in intensive care for so long, it really does absorb a lot of the capacity very quickly. And that's the most worrying thing, I think, that it's the amount of time that these patients are staying in hospital.
And Professor, well, some experts say that this resurgence could have been avoided if those in power took corresponding measures in the early stages of the pandemic. What's your stance on voices that think the WHO and the CDC and others fumbled the initial response?
There's very good evidence now that the virus had already escaped from China. It had traveled to other parts of the world by early 2020. So even if action had been quicker, once this was recognized in mid-January 2020, it would have been too late to stop global spread. If we had a time machine now, we could go back to say January of 2020 and ask everybody in the world to stay at home for a month to avert this catastrophic pandemic. But in reality, I think it would be very, very difficult to really nip it in the bud. And for now, even if you're able to stop transmission now in Korea, get the numbers back down to zero, as soon as you open up again, as soon as you start relaxing the measures and allowing travelers back into the country again, the virus will be back. It will start spreading again. So I think it's something that we now just have to live with. It's not something we can hope to ever eliminate.
Yeah, it really seems like the term pandemic should stop being used at some point, and we should just call it what it is, which is it's endemic now. But finally, the WHO came out this week and rather surprisingly warned us that we could be facing a global shortage of syringes. Now, considering even the layperson knows that you need one needle per vaccine and you have to throw it away carefully after use, why wasn't production of syringes also ramped up to the same degree as vaccines?
Yeah, that's a really good question. Syringes, of course, are not only used for COVID vaccines, they're used for lots of different things in hospitals and clinics. And there is an enormous number of syringes used every year. But these additional need because of COVID vaccines mean that the global production does need to be increased. And it seems like maybe some of those syringe companies haven't increased their production capacity for whatever reason. And now there is a risk. I would say it's not an imminent risk, but it is a risk that later this year we'll run short of syringes. And maybe we'll still have enough for COVID vaccines, but maybe we wouldn't have enough for other things that we need syringes for. And that's going to present its own problems later. So I hope that it can be resolved with these syringe companies, which are located all around the world, just increasing their manufacturing capacity. And if they do it now, I think we'll be able to avert this crisis.
All right. Professor Cowling, thank you so much. We're grateful for your insights again. We'll hope to talk to you again soon.
Thank you.